Hello, I am Dr. N.S. Mani, and this is the fourth part of the ECG tutorial, which will help you to analyze the ECG. I am only dealing with the basic principles. Please consult standard textbooks for further details. Already I have uploaded 3 videos about some basics, and in this video today some parts of the ECG analysis on diagnosis of myocardial infarction is being dealt with. You can use the pause button and play button to control the speed of the video streaming if it is too fast. The 2007 Joint European Society of Cardiology, American College of Cardiology Federation, American Heart Association, World Health Federation (WHF), so ESC, ACCF, AHA, and WHF task force redefined acute and prior MI, that is myocardial infarction. They redefined the acute and prior myocardial infarction and proposed a new criteria necessary to secure the diagnosis. Now we will look into the definition of myocardial infarction. It's actually a long list. I will try to make it as simple as possible. So please follow the video audio closely. Criteria for acute myocardial infarction. The term myocardial infarction should be used when there is evidence of myocardial necrosis in a clinical setting consistent with myocardial ischemia. Under these conditions, any one of the following criteria meets the diagnosis of myocardial infarction. Detection of rise or fall of cardiac biomarkers, preferably troponin, with at least one value above the 99th percentile of the upper reference limit (URL), upper reference limit, together with evidence of myocardial ischemia with at least one of the following, like symptoms of ischemia, then ECG changes indicative of new ischemia, like new STT changes or new left bundle branch block (LBBB). Then development of pathological Q wave in the ECG, and imaging evidence of new loss of variable myocardium or new regional wall motion abnormality. In the coming videos, I will be showing you examples of the Q waves, STT change, and LBB. Then sudden unexpected cardiac death involving cardiac arrest, often with symptoms suggestive of myocardial ischemia and accompanied by presumably new ST elevation or new LBBB, and evidence of fresh thrombus by coronary angiography and at autopsy, but death occurring before blood sample could be obtained, or it can be at a time before the appearance of cardiac biomarkers in the blood. Criteria for myocardial infarction are any one of the following criteria meets the diagnosis of a previous myocardial infarction. One is development of new pathological Q wave with or without symptoms, imaging evidence of a region of loss of viable myocardium that is thinned and fails to contract in the absence of non-ischemic cause, then pathological finding of a healed or healing myocardial infarction. For percutaneous coronary intervention (PCI) in patients with a normal baseline troponin value, elevations of cardiac biomarkers above 99th percentile URL are indicative of peri-procedural myocardial necrosis. By convention, increase of biomarkers greater than 3 into 99th percentile URL have been designated by defining PCI related myocardial infarction. A subtype related to a documented stent thrombosis is recognized. For coronary artery bypass grafting (CABG) in patients with normal baseline troponin value, elevations of cardiac biomarkers above the 99th percentile URL are indicative of peri-procedural myocardial necrosis. By convention, increase of biomarkers greater than 5 times the 99th percentile URL plus either new pathological Q wave or new LBBB, or angiographically documented new graft or native coronary artery occlusion, or imaging evidence of new loss of viable myocardium have been designated as defining CABG related myocardial infarction. Criteria for the diagnosis of acute myocardial infarction. Acute coronary syndrome. The term acute coronary syndrome ACS is applied to patients in whom there is a suspicion of myocardial ischemia. There are three types of ACS. ST elevation, formerly called Q wave MI, or STEMI, STEMI. Then non-ST elevation, formerly called non-Q wave MI, NSTEMI, NSTEMI, and unstable angina, that is UA. The first two, that is STEMI and NSTEMI, are characterized by a typical rise and or fall in biomarkers of myocyte injury. The criteria used to define MI differ somewhat depending upon the particular clinical circumstance of the patient. Those suspected of acute MI based upon their presentation, those undergoing either coronary artery bypass graft surgery or percutaneous intervention, or those who have sustained sudden unexpected cardiac arrest with or without death. For all other patients in whom there is a suspicion of MI, a typical rise or gradual fall of troponin or more rapid rise and fall of CKMB of biomarkers of myocardial necrosis with or at least one of the following is required: ischemic symptom, development of pathologic Q wave in the ECG, ECG change indicative ischemia, that is ST segment elevation or depression, imaging evidence of new loss of viable myocardium or a new regional wall motion abnormality. The Joint Task Force further refined the definition of MI by developing a clinical classification according to the assumed proximate causes of the myocardial ischemia: type 1, 2, 3, 4A, 4B and 5. Type 1, MI consequent to pathologic process in the wall of the coronary artery like a plaque, erosion, rupture, fissuring, dissection. Type 2 is MI consequent to increased oxygen demand or decreased supply like coronary artery spasm, coronary artery embolus, anemia, arrhythmia, hypertension or hypotension. Type 3 is sudden unexpected cardiac death before blood samples for biomarkers could be drawn or before their appearance in the blood. Type 4 is divided into A and B. 4A means MI associated with percutaneous coronary intervention. Type 4B is MI associated with the stent thrombosis, and type 5 is MI associated with the coronary artery bypass graft surgery. Further details of ECG tutorials, basic principles of ECG analysis are to follow. It includes more details on myocardial infarction. I am Dr. Nasmani, and my channel address is youtube.com/ACEPGmet. If you got Facebook account, please make friends with facebook.com/ACEPGmet. After inviting as friends, please click like. Thank you.